Hello, and welcome to our session, Employing Internationally Trained Professionals in Long-Term Care. If that doesn't sound like what you'd signed up for, please stick around anyway. We have some interesting content to share with you. We've got a maximum of 45 minutes with you today, and we have some slides to share and a few poll questions. And we're going to welcome your inputs via the chat functions. It's poll time. So please fill the poll out, and we'll continue with our introductions. This is going to help us know who's in the room today. Paulo, can you share a bit of information about yourself?
Hello, everyone. My name is Paulo Varias, and I'm an internationally educated nurse originally from the Philippines. Currently, I work in long-term care as a long-term care administrator in one of the long-term cares in Kingston, Ontario. Previously, I also worked as a director of care in a different long-term care home in Kingston, Ontario. Thanks, Carl.
Thank you, Paulo. My name's Carl Flecker, and I'm the Associate Director of Policy Advocacy with World Education Services. WES is both a credential assessment organization and a social impact organization. We help people learn, work, and thrive in new places. And through our social impact work, we help society recognize the value of people's education and experiences gained from other parts of the world.
My name is Caroline Ewan. I'm the Manager of Policy and Advocacy with the Research and Policy team at World Education Services, working quite closely with Carl, and I'm joined today by Paulo. Very briefly, the outline of the session as it will proceed today, we'd like to briefly contextualize, the state of the long-term care sector in Ontario, before looking more closely at the underutilization of internationally educated health professionals in this context. We'll look at some recent initiatives as well as some ongoing barriers facing internationally educated health professionals in Ontario, and speak a little bit about what it would look like to have an integrated strategy to integrate internationally educated health professionals, or IEHPs, into the long-term care workforce in Ontario.
Thanks, Caroline. Just go ahead.
So very briefly, a bit of context for our audience that's undoubtedly quite familiar. So the long-term care sector in Ontario, Ontario has 627 long-term care homes that employ over 100,000 staff. The majority in Ontario are private for-profit homes, and Ontario has a higher proportion of these homes than other Canadian provinces. Looking at the composition of full-time employees, or the staffing mix in long-term care, again, probably quite familiar to our audience, we see about a quarter of the full-time employees are nurses, and then we see that the vast majority in personal support worker roles. Important to note here is that there are growing needs in the sector. The number of seniors over 65 is expected to double in Ontario by 2046. And in addition to growing needs, there's a growing diversity of communities in Ontario that are in this context. So ensuring long-term stability in terms of staffing levels and staffing mix are real objectives here. But there are also, some long-standing challenges in the sector that Carl's going to speak to.
Thanks, Caroline. Yeah, let's take a closer look at the context of the long-term care sector in order to better understand where and how internationally trained professionals can fit. Now, the pandemic has exacerbated a number of longstanding issues. Number one, job quality concerns. There are low wage levels, variations in pay for long-term care workers, and that's been brought to the attention of the public and government. The sector also has challenging working conditions, including the risks of physical injury, exposure to the virus, and at various points, access to PPE, personal protective equipment. Staffing shortages. The pandemic has intensified a pre-existing issue. In 2021, the Ontario Health Coalition survey of long-term staff found that 95% of respondents reported workplace staffing shortages. Some long-term care homes were dealing with between 20 to 30% staff absences. Between April and July of 2020, the Canadian Armed Forces was called into the sector to help address the problem. Lastly, burnout and turnover. The Registered Nurses of Ontario conducted a survey in 2021 showing 1 in 3 RPNs were considering leaving the profession due to pandemic and high stress levels. Roughly 30% of RNs and RPNs in the sector hold down 2 or more jobs. Retention is poor. A survey of healthcare workers found that 54% of those working in long-term care Hospitals and community health settings are considering leaving their professions, and 70% of respondents cite poor wages, unsafe working conditions as the reasons why. 50% of PSWs, as Caroline's slide illustrated, are a major component of this group, and they stay for less than 5 years, 43% leaving due to burnout. These are troubling statistics. Paulo, you have a really interesting perspective. You're an IEN with training and experience from the Philippines and work experience in Canada at the community health level with extended care as administrator, and soon you'll be taking a job as the Associate Director of Clinical and Support Services with the Regional Municipality of Niagara. You'll be in the advantage fold. Can you comment on these three issues, job quality, staffing shortages, and burnout? How do they align from your perspective as an IEN and a long-term care administrator?
Yes, thank you, Carl. Yes, long-term care is a heavily regulated form of healthcare here in Canada, especially here in Ontario. Our regulation, specifically the Long-Term Care Act of 2007, specifically stipulates the regulation that needs to be followed by all long-term care homes. So what does that mean for us? So we are heavily bounded by these regulations that we actually need to meet. And if there are any violations or any situations wherein we are not able to follow these regulations, we are mandated by the legislation to report any of those incidents of non-compliance. So with that regulation, there is also a component of it wherein we have to make sure that we have enough staff to meet those regulations. And the challenge is, for years, long-term care has been facing severe understaffing and underfunding. And in fact, when COVID-19 pandemic has hit Canada, we have experienced, and it actually highlighted the long-standing issues of long-term care, which is underfunding and understaffing. And with that, and because it's a chronic issue, a lot of our team members, especially from the nursing department, our nurses are actually leaving the practice and trying to explore other areas of healthcare or even other opportunities outside of the healthcare sector.
Thank you, Paulo. So there's a coming together of these longstanding issues and the opportunity of IENs to be able to fill some of these gaps, correct?
That is correct.
Okay, it's poll time. We're curious to find out if what Paulo and I have just outlined fits with your experience in long-term care as well. So please take a look at the poll, but also feel free to add some details into the chat. We're going to continue with the presentation and come back later to what you share. Caroline, you've been researching the numbers of IEHP talent in the workforce. What's the data telling us about the state of play? This is particularly important for those who are doing the planning, workforce planning particularly.
Yeah, thanks, Carl. So looking here now at the contributions of internationally educated health professionals or IEHPs to the health workforce in Ontario and Canada, we know from available data that IEHPs comprise a significant and growing proportion of the healthcare workforce. So data from 2017, the labor force survey showed that 25% of the healthcare and social assistance workforce was comprised of immigrants. In Ontario, CIHI data shows us that 11% of the licensed RN workforce are internationally educated. And looking at, support roles, over 70% of nurse aides, orderlies, and patient service associates in major urban centers in Canada are immigrants. So some really significant contributions from what the available data shows us. And of course, in the context of care work, we need to bring up considerations related to factors such as race and gender. So here, data reveal that there is significant overrepresentation of racialized immigrant women in care-based roles. And these stats are really important to contextualize, what we know about the contributions of IEHPs to the healthcare workforce, as well as to frame, some hypotheses about really significant underutilization of health education and training that we can see in this context, and particularly when it comes to internationally educated nurses. So I'll pass it back to Carl to provide a bit more information about the really significant skills underutilization that we're seeing.
Great, thanks, Caroline. As you said, this underutilization is really troubling. Nearly 50% of those with healthcare education that was obtained abroad are either unemployed or underutilized. 25% of immigrants are working as nurses' aides, orderlies, patient service workers. They hold a BA. And of those, nearly 70% also hold a nursing degree. With nearly 80% of those trained domestically, sorry, you really don't need that on. While nearly 80% of those trained domestically are working in their field, the percentage drops to just under 40% of those with a BA or higher that was obtained internationally. The internationally educated and trained are clearly a major part of our healthcare workforce. And Ontario relies on immigrants because our population labor force is immigrant driven. So these numbers are only going to grow, as you pointed out, Caroline. There are alarming levels of underutilization in the talent pool. And as you said, it's color coded, and women, particularly racialized women, are carrying much of the load. Paulo, can we ask you, what does this underutilization mean to people? What are they, as they're waiting to try and get on their career? And can you tell us a little bit about your personal experiences from your first arrival with your wife, who's also an IEN, until getting registered in 2016, I believe?
Yes, that's correct, Carl. So I'm not going to give you an example that is really very far from anything else, but I want to share my experience. So in 2014, my wife and I moved here in Canada from the Philippines, and at that time, we have attempted to work in long-term care and apply as a PSW or any other opportunities in long-term care at that time. However, we were not hired because we don't have PSW certificates or we don't have a Canadian healthcare experience. So unfortunately, because of that experience, we ended up working in a fast food chain in Kingston, Ontario. My wife was working as a cashier, and I worked as a grill master in that fast food chain. Given that we have like years of strong experience in different areas of healthcare, we had to do that. And unfortunately, for my case, I had to do that because I also have to pay for my bills. I have to make sure that my application to become a nurse with CNO is ongoing, because that actually also requires lots of monies in terms of payment for assessment and to go through the process of credentialing. I think another example that I wanted to share with everyone is currently I'm actually working here in the organization with a newcomer as well, who was originally from India, and she was a dentist there, and currently she works as scheduling coordinator in our organization. Unfortunately, she's been wanting to work as a dentist, but because of the expensive amount of money that is being required for her to go through the process of becoming a dentist, she has to save some money first. She doesn't have anyone with her as a support system, aside from few of her friends. So right now, she could actually be part of the healthcare team providing dental services, but unfortunately, our system is are created in a way wherein it's very difficult for the internationally educated health professionals to practice their original professions.
Thank you, Paulo. So I'm picking up that the IN community has got perseverance, but there's a lot of barriers there.
That is
Caroline,
correct.
Caroline, let's get back to the numbers. Can you say a bit more about the challenges you found with the available data? I'm figuring it's got to be relevant for those in the room who need to know how many IENs and IHPs are out there and where are they?
Yeah, absolutely, Carl. So a really common question that we hear is, and a basic question, how many internationally educated nurses are in the country, are in the province? And unfortunately, the existing data sources, data challenges, I should say, prevent us from getting a full picture. So, what we see on this slide is both what we know, so that we know that there's significant growth in the number and proportion of IENs working in Ontario, and particularly as the table here shows in long-term care. So growth of 21% between 2011 and 2020 for immigrant nurses working as RNs or NPs in Ontario. Unfortunately, this doesn't paint the full picture, because what we don't know from available data is how many IENs are living and working in Canada in non-nursing professions or professions outside of healthcare. We don't know how many are seeking to re-enter their professions, or at what phase they are in terms of the process of professional registration. And to highlight this, we've pulled some data from the College of Nurses of Ontario that shows that in 2020, over 14,000 IENs were pursuing registration, and yet in that year, only 2,100 were deemed eligible to register. And this is really significant. Recent research shows that in recent decades, almost half of women who entered Canada through the Live-In Caregiver program held a bachelor's degree, and a very large proportion of these likely hold nursing degrees. So the available data points to a really high degree of underutilization that's being shaped by certain immigration pathways, that's not being very effectively tracked or accounted for in the labor market. And what this results in is really a lose-lose situation for both the individuals who are seeking to re-enter their professions, as well as for employers who could benefit from that these folks are bringing.
Thanks, Caroline. That's amazing. That's very troubling. So it's poll time. Let's find out from you in the room. Do you know how many IENs or other IHPs in your workplace? And please add in the chat, how did you find out? What measures did you use? Staff surveys? Was it part of your onboarding strategies? We'll come back to that later. Paulo, both as an IEN manager and an IEN and a manager, what are the challenges in getting this type of census or demographic profile information? Are there systems in place in your workplaces to protect this potential talent, to track this potential talent?
To be honest with you, right now, I don't think there is an existing mechanisms in place to track and to manage the opportunities that are available when it comes to the number of IEHPs or IENs that are presently working in our sector. So that is one of the challenge, and I think it's an opportunity for us, the leaders who works in long-term care, to find this opportunity as a potential process in terms of succession planning that would actually assist us and secure us, especially right now that there is a new regulation coming that we have to meet the 4 hours direct care in long-term care. So it's an opportunity for us to develop future talents, and then at the same time assisting these IENs as they are working towards becoming an RN.
Thanks, Paulo. Do you have any practical tips that you might be able to share with your colleagues about how to find the IEN community?
For sure. I think one important piece is that you will encounter a lot of applications right now coming from IEHPs. My suggestion is to entertain them, figure out if they are a right fit for your organization. If you deem that they are right fit for the organization, then I think it's important as well that during the onboarding process to identify what are the gaps or what are the areas that they would actually require support, so that they would be able to be part of our workforce, so that they will be able to become an RN or an RPN in the future, because that will actually assist you in terms of securing a very sustainable staffing in the organization.
That's great. Thank you, Paulo. And through the chat, I think that Paulo is an immense resource that could be very helpful to other colleagues here. Caroline, we've heard, read, seen the government respond to the 3 big issues that we've talked about: staffing shortages, wages, burnout. Can you highlight a few recent announcements that perhaps point to some systems change level remedies?
Yeah, absolutely. Thanks, Carl. So we wanted to take this point of the presentation to highlight a few recent government initiatives or announcements in Ontario, many of these stemming from funding that was made available through the Long-Term Care Staffing Plan, which was released in December of 2020. And so what we saw here in October 2021 was a really positive initiative that expanded bridge training seats for IENs and also provided up to $6,000 a year in financial assistance. So this was announced concurrently with the Begin initiative, Bridging Educational Grant in Nursing, which provided an additional tuition support program for those pursuing RN or RPN certification. Following that, in January of this year, the CNO announced another really positive step, which was the Supervised Practice Experience Partnership. And so what this did was build on the very successful externship pilot program. And what it does is facilitate supervised placements for IENs who have met all registration requirements except for language and evidence of recent practice. So filling a really important need here in terms of providing those opportunities to obtain those requirements while under vision. In February of this year, we saw really significant funding announcements for supports to to training and clinical placements for PSW and nursing students. And then most recently in March of this year, the government announced new legislation under a plan to stay open. And if passed, what this would mean is it would prohibit regulatory colleges from requiring Canadian work experience in order to qualify for professional registration in Canada. So these are all very promising, initiatives on their own in terms of providing those necessary supports to IEHPs. But much remains to be seen about the longer term impacts of these initiatives.
Great. Thank you, Caroline. Okay, well, it's poll time. We're interested in knowing if you're aware of these initiatives, and we'll come back to it in the chat to find out what you do know, how to access them, challenges, and so on. But while you're doing the poll, Paulo, I've got two questions for you. What do these initiatives mean for IENs? What do they mean for management? And Caroline, for you, what's missing from the recent announcements? You alluded to that. What needs to happen to improve the reach and impact of these initiatives? Paulo?
Yeah, I think this is a very, very exciting news, especially for the IENs or IEHPs, wherein they are being given the opportunity now, and that the government as well recognizes some of those gaps in terms of like the credentialing process and the ability for them to register with the College of Nurses. So it's a very exciting opportunity for them, and that they know that there is now a clearer path in terms of becoming a nurse here in Ontario. In terms of the management level, I see it as well as an opportunity for us, because if the recruitment process is just focused on the number of like graduates coming from our colleges and universities here in Canada, I think it's not going to fill the gap in terms of the understaffing and the need to hire for more nurses. And I think with this programs, it would actually assist in terms of allowing internationally educated nurses to register and bridge those gaps that they actually require to become nurses here in Ontario.
Thanks, Paulo. Caroline, over to you. What's missing? What needs to happen?
Yeah, absolutely. So as I noted earlier, much remains to be seen about, these recent initiatives. So about the long-term impact of these standalone initiatives. And, these are really significant steps and quite significant funding allocations. However, we need to make sure that they don't become siloed, and that these programs, as they unfold, connect policy to implementation in a strategic and in a cohesive way. So that's what I would add about, what needs to happen in terms of improving the reach and impact of these initiatives.
So what I hear you saying is you're talking about an end-to-end initiative. Can you say more about what's the bottom line of all this? What are we looking at?
Yeah, absolutely. So again, connecting, making sure that, standalone programs don't become, siloed. You could have a really positive initiative, say, for example, around, expansion of bridging seats as we've seen. But unless they're really connected in a strategic way, we're going to have just more single standalone solutions. And so going forward, and we'll speak a little bit more to this towards the end, what we're really calling for and advocating for is a systemic and strategic approach to IEHP workforce integration that can connect aspects of the immigration process to aspects of the regulatory or licensing process, all the way to employment and workforce integration. So this end-to-end strategy, integrated strategy, is what we're calling for going ahead.
What that suggests to me then is, because there's many different stakeholders from the federal level, the provincial level, the regulators, the training institutes, the workers themselves. This has to be a multi-stakeholder approach. This can't be solved by one particular piece of the health ecosystem. Am I correct?
Yeah, absolutely. I would agree with that.
Okay, let's move on to the next slides towards an integrated strategy. Caroline, Paulo, you've provided insights into the challenges facing IEHPs, and despite the data challenges, it's quite evident that this community is integral to our healthcare workforce. We need to rebuild the domestically trained side of the equation, and we need to integrate the globally trained side. The latter, as you've mentioned, Caroline, have specific barriers and needs: immigration, registration, inclusive and commensurate employment. Paulo, question to you. How does the IEN fit into health human resource planning that's needed? Do you have advice for your colleagues? on how to move HHR planning forward from where you sit?
Yes, definitely. I think the presence of internationally educated health professionals and IENs are critical, especially in our workforce right now. Especially that Canada's population is actually very diverse. And we know that immigrants who moved here in Canada back in the 1970s and 1960s, and I'm speaking in terms of the long-term care sector, we know that they are now transitioning to long-term care. We know that majority of them are all the older adults now requiring care and requiring more support. And that is a challenge for us leaders in the healthcare sector to make sure that we are actually providing quality care. And when we say quality care, we're talking about care that is actually culturally sensitive and specific to the needs of this population. And how do we approach that? The answer is actually just around us. We need to have more internationally educated health professionals working in the healthcare sectors because they are actually the experts in terms of providing this culturally specific care. We know that if they are the ones providing care, that the care that they are providing would actually be catered or tailored towards the needs of our patients or of our residents in long-term care. I think another one that we have to do is we have to strengthen our onboarding process and develop an approach so that we are able to develop some sort of like mechanisms wherein we could track the internationally educated health professionals working in our sector and at the same time use our efforts in terms of human resources planning to ensure that we are actually integrating them in towards our succession planning and at the same time assisting them as they are working towards practicing their professions here in Canada.
Thank you, Paulo. That's a great point. As our population becomes more diverse, as it ages, there's a need not only for the linguistic skills, but as you said, the cultural competencies to be able to deal with that. That fits in that third bubble about the employment. And the other pieces that are on the screen, the immigration and registration pieces, are also going to require advocates at the long-term care sector to be able to say, we need these changes in order to hire folks. Caroline, anything to add?
Yeah, absolutely. So we're nearing the end of the session here, and throughout we really wanted to emphasize that there is a need for an integrated strategy to effectively integrate internationally educated health professionals into the healthcare workforce. However, with a nod to the audience here today, we recognize that many employers are asking very practically, where can I turn for supports? Who can I approach in terms of getting help in identifying and recruiting qualified internationally educated health professionals? And so what we're going to do for this session is that we've put together a resource that we're going to be sharing through the FeedLoop platform that outlines in Ontario available bridge programs, settlement and employment services, as well as professional associations, as a tool for folks who are looking, for answers around who can I connect with, who can I approach to be practically recruiting, qualified health professionals to your organization. So we'll share this as a resource through the platform and hope that it can be a useful tool for your organization.
Great. Thank you, Caroline. And thank you, Paulo. And thank you, everyone. Thanks to the folks behind the scenes for making the session possible. We've got one last poll. Let us know how you found the session. And once again, thanks, everybody. Stay safe.